Okay, let's come to another discussion whereby we will be able to identify the true pelvis and the false pelvis, and as well, we can be able to understand what are found on these two parts of the pelvis. So the bony pelvis is divided into superior and inferior portion by a boundary called the pelvic brim or the inlet. And with the description, you can as well trace the following landmarks around the parts of the hip bone to form the outline of an oblique plane. So let's consider how we can find the pelvic brim. Beginning posteriorly at the sacral promontory, trace laterally and inferiorly along the arcuate lines of the ilium, continue inferiorly along the pectine lines of the pubis, then finally trace anteriorly along the pubic crest to the superior portion of the pubic symphysis. So together these points form an oblique plane that is higher in the back than in the front. And the circumference of this plane is the pelvic brim. So we have been able to identify how to trace the pelvic brim, and finally we have been able to find out that the circumference of where we've been tracing is now known as the pelvic brim. So the portion of the bony pelvis superior to the pelvic brim is the falls or the greater pelvis. It is bordered by the lumbar vertebrae posteriorly, the upper portions of the hip bones laterally, and the abdominal wall anteriorly. The space enclosed by the false pelvis is part of the lower abdomen, and it contains the superior portion of the urinary bladder when it's full and lower intestines in both genders. And as well, the uterus, ovaries, and uterine tubes of female are found here, which projects into this region and are covered by the peritoneal serous membrane. So these are the contents or the folds of the greater pelvis. Okay, moving ahead, let's see. We have the part painted pink is the false pelvis or the greater pelvis. And on my right, we have the part painted blue, which is the true pelvis. So the portion of the bony pelvis inferior to the pelvic brim is the true pelvis or the lesser pelvis. It's bounded by the sacrum and coccyx posteriorly, inferior portions of the ilium and ischium laterally, and the pubic bones anteriorly. The true pelvis surrounds the pelvic cavity and contains the rectum and urinary bladder in both genders, the vagina and cervix of the uterus in females, and the prostate in males. So those are the contents found on the true pelvis. Mark them, analyze them, and please, if you have any question considering them, just ask or pass them through the comment box. The superior opening of the true pelvis bordered by the pelvic brim is called the pelvic inlet, and the inferior opening of the true pelvis is the pelvic outlet. The pelvic axis is an imaginary line that curves through the true pelvis from the central point of the plane of the pelvic inlet to the central point of the plane of the pelvic outlet. So that's how the pelvic axis can be drawn or how it can be placed on that bony pelvis. So let's just see that description on an image. Okay, we have during childbirth, the pelvic axis is the route taken by the baby's head as it descends through the pelvis. And we have this instrument. Pelvimetry is a measurement of the size of the inlet and outlet of the birth canal, which may be done by ultrasonography or physical examination. Measurement of the pelvic cavity in pregnant female is important because the fetus must pass through the narrow opening of the pelvis at birth. So that's another topic of discussion, and maybe if time will allow, we will be able to understand how it's taken. But just have prepared an image to demonstrate how that line comes to it. So we have The sacral promontory, we have the pelvic brim, which I earlier described. We have the pubic symphysis, the pubic crest, pectineal line, whereby we were able to describe how to palpate or to trace them. Then we could be able to find the pelvic brim, sorry. So we have the pelvic axis, which I've just described. And we have the true pelvis here. We have the false pelvis above here. So this is just but a description. I'll next time try as much to find 3D images so that I can be able to improve on our demonstration using a demo graph. So we have here another topic of discussion whereby we will be able to do a comparison of female and male pelvis. So let's consider about this just in a little while so that you can be able to understand what does it entail. We have general structure for female and male, and then the point of comparison. So for false pelvis, for general structure in female, their pelvis is light and thin, while for male is heavy and thick. For false or greater pelvis, for female is shallow, while for male is deep. The pelvic brim is wide and more oval in female, while in male is narrow and heart-shaped. Then the cerebellum in female is small and faces anteriorly, while in male is large and faces laterally. The obturator foramen is oval in female, while in male is round. The pubic arc is greater than 90. It's greater than 90 degrees in angle. That is in female, while in male it's less than 90 degrees. That's the pubic arc. Moving to the next, we have the iliac crest. In female is less curved, while in male it's more curved. You can as well check from the images just down there to do some comparison between the two of the male and the female pelvic. The ilium is less vertical, that's for female, while in male it's more vertical. The greater sciatic notch. In female it's wide, which is almost 90 degrees, while in male it's narrow, about 70 degrees inverted V. Coccyx, more movable in female and more curved also in female, that's anteriorly, while in male, the coccyx is less movable and less curved anteriorly. And the sacrum is shorter, wider, and less curved anteriorly in female, while in male it's long, narrower, and more curved anteriorly. Then we have the final part. The pelvic outlet in female is wider, while in male it's narrower. The ischial tuberosity is shorter, further apart, and more medially projected or projecting in female, while in male it's longer, closer together, and more laterally projecting. And that marks the end of our